One thing that nurses do 90% of the time is to teach, and I love doing that.
My initial pathway into teaching was not the typical. I was a full-time nurse anesthetist over at the R. Adams Cowley Shock Trauma Center, and one of my colleagues happened to be a faculty member here at the School of Nursing. He asked me if I would come over and give a lecture one day. That one lecture led into several more, and pretty soon an adjunct faculty position, which 10 years later turned into a full-time position.
By the patient bedside, you are influencing and touching the lives of the patient. As a faculty, you are touching many lives of the nurses, future generation of nurses, who will be touching many lives of patients. So I think of it as an exponential effect.
The program that I did was health services and leadership management, so I had an exposure to both the management side of things and the education side of things, and it became very apparent very early on that the education focus was what I enjoyed doing.
If you can remember what it was like to be a student, that will help you in education, because while we're still trying to grow students, we're not in their shoes, so we forget what that's like. So remembering that is really important.
I wanted to just be a family nurse practitioner at first, and then decided during that path when I was in a nurse practitioner program that education, teaching was really what my love was for.
You know, being a nurse educator isn't easy. But I'm passionate about it, and so that's what I do. I'm passionate about teaching and learning. I'm passionate about being a resource for new nurses, and I think if somebody else also feels that way, that they should go for it.
And so I got involved teaching at the hospital, teaching ACLS, CPR, different classes for the hospital, and I truly enjoyed doing it. And I thought, wouldn't it be wonderful if I could inspire other people in my profession? How can I make more of an impact?
I want them to get to that point where they are 100% comfortable knocking on the door, walking in, and introducing themselves as their nurse that day. And that makes me very happy. And if they can accomplish that with one client by the end of the first semester, that I've met my goal.
Probably your greatest contribution to the nursing profession is that you're preparing the future generation of nurses. And I find that rewarding every day that I come here.